Hello everyone, it is Dr. Nurse Tutor here. I am coming back with another video for you. This video is going to be geared towards my BSN or ASN nursing students because these questions are going to be MedSurge based questions, your Adult 1, Adult 2 type questions. We're going to break down these questions and rationalize the answers for these questions. I'm going to go over a few more than before. I think I should be able to squeeze in 10 questions as opposed to the 5 that I was doing before. Sorry for the hiatus. Like I just told my last group of people in my LPN video that I made, I've been on a bit of a hiatus because I have taken another professor role at a college here in Atlanta. So I'm working at 2 colleges, and I just and it's just a little time constraining for me, but I wanted to come back in and create some videos because I know I do have some students who have graduated, are graduating, and are getting ready to take their NCLEX exams. So I did want to create some new content to have available for you, or even if you're in your BSN or ASN program and you just need some questions to help make things a little easier with understanding and rationalizing these answer choices. So without further ado, I'm going to go into the first question. The first question says, a 32-year-old client is recovering from a sickle cell crisis. The client's discomfort is controlled with pain medications and discharge planning has been initiated. What medication will the nurse anticipate to be prescribed before discharge for the patient? So, a couple of things we have to understand in this question, right? This patient has sickle cell. The patient came in with sickle cell crisis. If you don't know now, you will eventually come into understanding what sickle cell is. Sickle cell, of course, is misshapen red blood cells. They are sickled. They are not that biconcave shape that red blood cells usually are, that circular shape that red blood cells usually are. They are sickled. So what happens is those red blood cells pack on top of each other. It's hard for them to circulate through the blood vessel, which leads to circulation issues. We don't have blood going to our organs, our muscles, our tissues as effectively. And when that does happen, these patients can go into crisis. This crisis causes extreme pain and dehydration. So the biggest things that we have to understand for sickle cell patients are pain and dehydration. And usually, you're not going to be able to resolve that pain until you hydrate your patient. So we want our patients to be free of pain, but please understand that even though you have to give pain medicine to sickle cell patients, if you don't hydrate them, you're never going to resolve their pain. So it's always the biggest thing that you want your patients to understand is to stay free of pain, you need to be hydrated. Okay, so if your answer choice doesn't have something to do with pain and hydration, hydration should be what you're looking for first, because you need to hydrate that patient to take them out of crisis, which will help to subside the pain. Usually the answer choice will include pain and hydration. Sometimes it may just say hydration, but if you see an option that has pain and then another option that has hydration, understand that you have to hydrate your patient in order to resolve the pain. Hopefully, the answer choice will have pain and hydration inside of the answers, okay? So a 32-year-old client is recovering from sickle cell crisis. The client's discomfort is controlled with pain medications and discharge planning has been initiated. What medication will the nurse anticipate to be prescribed before discharge? A says heparin, B says warfarin Coumadin, C says hydroxyurea, Droxia, and D says tissue plasminogen activator TPA. Let's break this down. Discharge planning has been initiated. What medication are we going to anticipate for discharge with this patient? None of these options said anything about pain or hydration, right? Because you may have been looking for maybe a pain medicine or some sort of something that's going to hydrate your patient. Heparin and warfarin, they are blood thinners, right? Sickle cell patients are usually not on blood thinners. The red blood cells are sickled, though they are at risk for clots. This patient is nothing in this question said anything about the patient clotting or having a clot. So this patient's not going home with heparin or warfarin. And if you understand the medications, you know that they're both blood thinners, right? So if heparin's not an option, then warfarin shouldn't be an option because they're both blood thinners. Now we're left with hydroxyurea and we're left with TPA. If you know anything about TPA, TPA is not administered at home. TPA, of course, is also a blood thinner, but it is a fibrinolytic. It's a clot buster. So we usually giving TPA for a patient who has had a stroke due to a clot, a thrombotic stroke, or a patient who has thrown a clot and had a heart attack. That's the only time we're giving TPA. Okay, it's a clot buster, and that is given in emergent situations. That's not something that's given at home. So TPA should have been the first thing that you crossed out, because if you know anything about TPA, it's a fibrinolytic, and usually we're giving TPA to a patient who has had a clot suffering from a stroke, and we want to break up that clot. So it's not TPA. Okay, and then also with sickle cell, we're not usually giving patients warfarin or heparin unless they have a clot. So that's not an option either. The only other option, even if you didn't know what hydroxyurea is, please note that TPA has to be given in emergent situations for some sort of a clot. Okay, and usually it's the brain. It's usually a stroke, a thrombotic stroke. Heparin and warfarin, they're also blood thinners, and we're not giving blood thinners for sickle cell. The only other option would be hydroxyurea, and hydroxyurea is a medication that we do use for patients when they go home who have sickle cell to try to reduce sickle cell crisis. But like I said, in the instance, if you didn't know what hydroxyurea is, please know that TPA is not given at home. Heparin and warfarin, are not going to be given for sickle cell patients, and also heparin, warfarin, and TPA are all blood thinners, right? So if you couldn't give one, you probably weren't going to give the other ones, and know that we're not giving blood thinners for sickle cell patients, especially TPA. All right, next question, number 2. The nurse is transfusing 2 units of packed red blood cells to a post-operative client. What electrolyte imbalance should the nurse monitor for after the blood transfusion? So we know that red blood cells usually come from a donor, right? So on top of having the red blood cells, you will be transfused with some electrolytes that may be inside of the blood. Now understand, make sure that you understand what your critical electrolytes are. And your critical electrolytes are your electrolytes that you need to specifically monitor this patient for cardiac arrhythmias. Okay, now our options are hyponatremia. Hyponatremia means low sodium. So if I'm giving packed red blood cells that may have electrolytes in them, if there is sodium in it, I probably may not be monitoring my patient for hyponatremia. Now we have hyperkalemia. We have hypercalcemia. Those are 2 hyper things, right? Because if there's electrolytes, the patient may run a risk of having hyper something, right? It shouldn't be hypo, like hypomagnesium, which is option D. If there's magnesium in it, I'm not worried about my patient having hypomagnesium or hyponatremia, okay? Because if there's electrolytes in the blood, then the patient is probably going to get electrolytes. Now I'm stuck between hyperkalemia and hypercalcemia, because there may be calcium and there may be potassium inside of the blood. Which one out of these electrolytes would I be the most concerned about? You should know that you should be the most concerned about hyperkalemia. Hyperkalemia is a high potassium. We know that potassium is that electrolyte that directly works on the heart. Okay, whether if it's hypokalemia or hyperkalemia, you should always be on alert when you're dealing with potassium levels, because whether it's low or if it's high, your patient is at risk for an arrhythmia. Okay, so if there are electrolytes inside those red blood cells, specifically potassium, you want to make sure that you are assessing your patient's vital signs and maybe having that patient on a heart monitor. You want to assess that patient for hyperkalemia. The answer is B, hyperkalemia, in case that patient's potassium level spikes up. So maybe something like a heart monitor, maybe an EKG, especially vital signs. But you're worried about B, hyperkalemia, because if that patient's potassium level spikes up, we're now going to be worried about arrhythmias. Okay, so the answer is B, hyperkalemia. Number 3 says, a recently admitted client who is in sickle cell crisis requests something for pain. What medication will the nurse be prepared to administer? Sickle cell patients are in extreme pain. They're usually not going to get oral anything, because whatever medication they're going to receive needs to go through an IV, and it needs to work on them almost immediately for their pain while they're being hydrated. So your answer options are A, oral ibuprofen Motrin, B, oral morphine sulfate MS Cotton, C, intramuscular morphine sulfate, D, intravenous IV hydromorphone. Anything IV, please give it. Anything IV, please give it. If I have an IV, I probably shouldn't be giving anything IM. Usually if we're giving medications IM, it's because the patient doesn't have an IV yet. It's an emergent situation. I have to administer something now. But usually your sickle cell patients are going to have an IV. So you want to make sure that the order is for an intravenous medication, especially if your patient is in sickle cell crisis. Nothing oral. So we're not giving oral ibuprofen. We're not giving oral morphine, because that's going to take way too long to work. Way too long to work. Intramuscular morphine sulfate, we're trying to confuse you there, because intramuscular does go into the bloodstream, but IV is always the fastest. That IV intravenous hydromorphone dilaudid is what you're going looking for this patient. All right, number 4, a client who has been newly diagnosed with leukemia is admitted to the hospital. Avoiding which potential problem takes priority in the client's nursing plan? We have A, hypoxia, B, infection, C, hemorrhage, D, fluid overload. Leukemia is a cancer. It's a virus. The virus attacks the immune system and it suppresses your immune system. By suppressing your immune system, it makes you susceptible to infections. That's what leukemia does. It's a cancer that affects the immune system and your blood. It's a cancer in the blood. So it directly affects your immune system and it suppresses your immune system. Now, if you remember, or if you've had pathophysiology, you should already know that your immune system is responsible for activating to protect the body against pathogen, microbes, bacteria, and viruses. When you have cancer, the cancer suppresses your immune system, so it makes your immune system less effective, which will make your immune system susceptible to infection. So the answer is B, infection. It's not going to be hypoxia. Leukemia is not going to affect your breathing. Leukemia is not necessarily going to cause you to hemorrhage, and leukemia is not going to cause you to go into fluid overload. Leukemia is going to suppress your immune system, which is going to make your immune system less effective, which is going to increase your risk for infection. Okay. Number 5 says, a client with multiple myeloma reports bone pain that is unrelieved by analgesics, pain medicine. What is the most appropriate response by the nurse? Usually when it says most appropriate, it's what is the best right answer. So your patient with multiple myeloma, which is a cancer, reports bone pain that is unrelieved by analgesics, which is pain medicine. What is the most appropriate response by the nurse? A says, ask your doctor to prescribe more medication. B says, would you like to try some relaxation techniques? C says, I'll turn on some soothing classical music for you. D says, is it too soon? It is too soon for additional medication to be given. I can see how this could be difficult. I just taught a class about therapeutic communication. So the problem with this is all these things sound right? But what is the best way to answer this patient who was given pain medicine, and it's probably too early to get more pain medication? What is the best way to answer this patient without, one, offending this patient, and two, without making this patient feel like they're hopeless? Okay, now let's look at the options. A says, ask your doctor to prescribe more medication. That is an option that a patient can do, but the patient has no idea when the doctor's coming in. A lot of times when doctors do their rounding, they do their rounding first thing in the morning, and the patient doesn't see the doctor again until the next morning. So chances are the doctor's not even coming around for the patient to ask for more medication. And also, that's the nurse's job. If your patient is having pain and the pain medicine is not working, the nurse should be calling the doctor to let the doctor know, hey, this patient's pain medicine is not working. Can you order something stronger or increase the dosage? So that is not the answer. B says, would you like to try some relaxation techniques? I like B, but I want to see the other options. C says, I'll turn on some soothing classical music for you. I like that too, so I'll hold on to C. And then D says, it is too soon for additional medication to be given. That doesn't help the patient. This is therapeutic communication. You need to give the patient options that are going to be helpful for what it is they're going through. Because by you telling me that it's too soon for additional medication, that does nothing for the pain that I'm feeling right now. So you telling the patient to call the doctor for more medicine, that's not the patient's job, that's your job. And D, by telling the patient it's too soon for additional medication, that does nothing to help the patient who is in pain. So we have B, would you like to try some relaxation techniques? And we have C, I'll turn on some soothing classical music for you. Now we're stuck between B and C. Let's see how we can rationalize to make it make sense. C says, I'll turn on classical music for you. What if I don't like classical music? You're assuming that because classical music is considered music that calms people down, it doesn't mean that it's music that calms everyone down. Classical music, your patient may hate classical music, so that can't be the only option that you give them. Though classical music can be therapeutic and calm people down as a relaxation technique, we can't just assume that it's going to calm everyone down. B says, would you like to try some relaxation techniques? B opens the door for you to give your patient the different options of different relaxation techniques so your patient can choose which one they would like to do. C is a little bit more specific and you're not giving me any other options, whereas B allows me options. Now, when you ask your patient, would you like to try some relaxation techniques? You can then say there's yoga, there's music therapy, there's light therapy, such as going outside and getting a little bit of vitamin D. There is the waterfalls, those apps on the phone where you can hear the different waterfalls or the birds chirping and the ocean and all of that. That leaves the patient with the option to choose which will be more satisfying to them, as opposed to just saying, listen to some classical music to calm you down. So B would be the best answer choice to give the patient. Would you like to try some relaxation techniques? If the patient says yes, then you can go over the different relaxation techniques and have the patient choose the one which would be more satisfying to them. So the answer is B. You're not going to tell your patient to ask the doctor for medicine. You're not going to tell the patient that it's too soon for medicine. You're not going to assume that the patient likes classical music. You're going to ask the patient if they would like to try relaxation techniques. If the patient says yes, then you'll go over the different relaxation techniques with the patient to see which one is more suitable for them. All right, 6 says the nurse is caring for a client who is in sickle cell crisis. What action would the nurse perform first? which means all these options are probably correct. What are you going to do first? A says provide pain medicine as needed. B says apply a cool compress to the client's forehead. C says increase food sources of iron in the client's diet. D says encourage the client's use of 2 methods of birth control. My client is in sickle cell crisis. I already told you guys before. It's pain and hydration. The options are usually going to be pain or hydration, or pain and hydration. Remember, we cannot resolve pain unless we are hydrated. Okay, this one doesn't say anything about hydration, so we can cross that out. But of course, we see pain here, right? So you should already be looking at A as far as pain medication. That patient needs pain medicine. B says apply a cool compress, which is a good technique for that patient, but that's not going to relieve their pain. You should be applying that cold compress after you give me pain medicine, okay? C says increase food sources of iron in the client's diet after you relieve my pain. That should not be the first thing you're worried about. Yes, it is important. You could do that when I get a dietary tray or when you send me home, but that shouldn't be the first thing that we're looking for. D says encourage 2 methods of birth control. That's discharge education. And we don't even know if this is a man or a woman. It just says the client in sickle cell crisis, because it could be a male patient, but the question doesn't even say that. So D isn't even an option that we would think about. The correct answer is A, provide pain medicine as needed. 7, the nurse is to administer packed red blood cells to a client. How does the nurse ensure proper client identification? A says ask the client their name. B says check the client's armband. C says verify the client's room number. D says review all information with another nurse. You cannot do anything with packed red blood cells unless there is another nurse present. All information pertaining to packed red blood cells has to have another nurse with you. Even if you review it before that other nurse comes, you still have to go over it again with that other nurse, because that other nurse is your witness and they're your second set of eyes. Even if you know your patient, you've been taking care of your patient for the past 30 days, you cannot administer packed red blood cells unless you review all of the information with another nurse. There's nothing you could do by yourself when it comes to packed red blood cells. It has to be a second nurse. So the only answer that is acceptable is D, review all of the information with another nurse before you do anything else and when it comes to blood. 8 says the nurse performs an assessment on a newly admitted client with thrombocytopenia, low platelets. Which assessment finding requires immediate intervention by the nurse? Thrombocytopenia means low platelets. Platelets are needed for clotting. When someone has low platelets, they are at risk for bleeding, okay? So the nurse performs an assessment on a newly admitted client with thrombocytopenia. Which assessment finding requires immediate intervention by the nurse? Immediate. Client reports pain, A. B is increased temperature. C is bleeding from the nose. D is decreased urine output. A, client reports pain. Even if the client reported pain, that wouldn't be immediate. That may be something I need to address, but it wouldn't be immediate. And pain and thrombocytopenia don't go hand in hand. Thrombocytopenia is low platelets, low clotting. B says increased temperature. It says increased temperature, but it doesn't even tell us what the temperature is, right? Temperature and thrombocytopenia doesn't go hand in hand. It's low platelets, okay? And also it doesn't even tell us what the temperature is. C says bleeding from the nose. Thrombocytopenia is low platelets. If a patient has low platelets, they're going to be at an increased risk of bleeding because we need platelets for clotting. So if someone is bleeding from their nose and they have thrombocytopenia, I need to be acting immediately, right? But let's look at D. D says decreased urine output. Thrombocytopenia has nothing to do with urine and decreasing your urine output. Thrombocytopenia is low platelets, and I'm going to be worried about you bleeding. So someone bleeding from their nose is going to require immediate attention from the nurse if they have thrombocytopenia. 9, the nurse is infusing platelets to a client who is scheduled for a hematopoietic stem cell transplant. What procedure does the nurse follow for administering this blood product? So the nurse is infusing platelets to a client who is scheduled for a hematopoietic stem cell transplant. What procedure does the nurse follow for administering this blood product? A says the transfusion over 15 to 30 minute period. B says set up the infusion with the standard transfusing wide tubing. C says give intravenous corticosteroids before starting the transfusion. D says allow the platelets to stabilize at the client's bedside for 30 minutes. I giggled because you can't do that. Okay, so D, you should already know. You should not be leaving any blood products by the patient's bedside, so that's not even an option. C says give in, and you can't leave it there for 30 minutes. No blood products can be sitting outside for 30 minutes. So that should automatically tell you that D is not the option. 1, you can't leave it at my bedside. And 2, it shouldn't be sitting for 30 minutes. Because if it's sitting for 30 minutes or more, it cannot be used and it has to go back to the blood bank. It's no longer viable to use after 30 minutes. C says give intravenous corticosteroids before starting the transfusion. We usually don't give steroids to a patient because one, steroids suppress the immune system. And if we're having a reaction to a blood product, we kind of want to know. And if we give steroids, it could suppress a reaction to the blood products. We're usually not going to give steroids unless maybe there is some sort of a reaction. So we're not going to give steroids, which will suppress the immune system that would mask a reaction if that patient was to have a reaction to blood products. So that is not an option. We're not giving steroids before a transfusion because if the patient had a reaction to that blood transfusion, we would never know. So you cannot do that. B says set up the infusion with a standard transfusing wide tubing. We don't do that with platelets. We don't do wide tubing with platelets. The best answer is infuse the transfusion over 15 to 30 minute period. You're giving platelets over a 15 to 30 minute period when you are transfusing platelets. It's over a 15 to 30 minute period. That is the only answer that's acceptable in these options. 10 says the nurse is educating a group of young women who have sickle cell disease. Which statement from a class member indicates further teaching is necessary? So what statement by one of these members in this group shows that she needs more teaching because she may not understand what she was taught about sickle cell disease? So A says the pneumonia vaccine is protection that I need. B says getting an annual flu shot would be dangerous for me. C says I must take my penicillin pills as prescribed all the time. D says frequent hand washing is an important habit for me to develop. Now with sickle cell, like I said, those red blood cells are sickled. These patients are susceptible to all kinds of things. They are, of course, dehydrated. When they go through sickle cell crisis, they're going to experience a significant amount of pain due to ischemia and lack of blood flow because those blood cells are sickled. The immune system is going to be compromised. So a lot of these patients may be susceptible to infection when they have sickle cell disease. So understanding that they need to stay hydrated at all times is important, and understanding that they need to decrease their risk for infection is another very important component when it comes to sickle cell. So A says the pneumonia vaccine is protection that I need. That is very true. They do need the pneumonia vaccine. B says getting an annual flu shot would be dangerous for me. That's actually not dangerous because the same way you need a pneumonia vaccine is the same way you need a flu vaccine. So we're going to hold on to B. C says, I must take my penicillin pills as prescribed all the time. If you are prescribed an antibiotic and you have sickle cell, you need to make sure that you take them and you finish them. So that is true. D says, frequent hand washing is an important habit for me to develop. It's going to decrease your risk of infection as a sickle cell patient. So that is very, very important. So the only one that doesn't make sense that this patient would need further teaching for is thinking that an annual flu shot would be dangerous. So B is not correct. B would be the one where that person needs further teaching about sickle cell disease, because they need a pneumonia vaccine and they need a flu vaccine if they have sickle cell. So B is the answer. Getting an annual flu shot would be dangerous for me. All right, that concludes the 10 questions that I just went over. I hope this made sense. I hope this helped for NCLEX studying, as well as your MedSurge classes, your adult health classes, your pathophysiology classes, because these all pertain to those courses that you may be taking. Now, I will definitely do my best to make sure that I am coming back and making more frequent videos. I'm going to include more questions so you get a little bit more of me if I do have to take a little bit of a break as far as making videos. So this video is for my BSN students. I hope this does help with your studying and you get a better understanding of what these questions are asking and how to break them down, as well as think rationally through the questions. All right. Well, this is Dr. Nurse Tutor signing off, and I will see you later during the next video. Bye-bye.